Today we have a very young 65-year-old who plays golf and loves to travel. He's got an L4-5 spondy, look at that. So instead of being totally aligned on top of each other, this L4 is slipped forward on the L5 bone. And if you look at the MRI, it doesn't look that bad, but here's something interesting. The spondy is a lot better when he's lying down compared to standing up. What? So it just shucks back and forth when he goes from position to position. And imagine a tunnel made out of rings, and one ring moves forward on the other. The central portion of the tunnel gets smaller. That's an oversimplification, but there's also facet fluid because the facet joints are overloaded. The nerves are have a tourniquet around them, and this causes pain. And it's something called neurogenic claudication, which feels like you have tourniquets on your upper thighs and your legs get really heavy, achy, numb and tingly, weak, sloppy, or a combination thereof. So we're going to do a minimally invasive TLIF. We want to restore the height of this collapsed disc. We want to pull that bone back. We want to create the wedging or the lordosis back again. And in doing so, we will open up the canal through indirect decompression. And instead of making a midline incision and destroying all these important, powerful paraspinal muscles, we're going to take two separate paramedian approaches using a tubular retractor system. And by doing that, you don't crush the muscles, you don't detach the tendon of the multifidus muscle from the spinous process. That decreases bleeding, decreases postoperative pain, allows for earlier return to function, and probably decreases the rate of adjacent level degeneration, because when you fuse these two segments, the segment above and below will experience extra forces, and the only way to dampen that is to maintain the dynamic stability of the spine, which is what the multifidus muscle and the other paraspinal muscles do. So that's one of the key bases of minimally invasive spine fusion surgery. Do not crush muscle or detach muscle tendons. Do not make unnecessary empty void pockets of soft tissue. Okay, starting out with navigation to find the perfect entry point. Because my mom always said, if you don't cheat every once in a while, you ain't trying hard enough. And I feel like a cheater because it's, I don't know, too easy when it's like this. But I do have the most incredible freehand straight line drawing skills this side of the Mississippi. I still have that. Fusion, but already you can tell how unstable it is. First of all, the spondy is almost completely reduced and the facet joint gap is massive. You're going to feel so much better. I can't wait for you to wake up and go, oh my God, this is so amazing. I cannot do surgery without navigation anymore. It would be like, I don't know, not having power steering or power lock brakes or heated car seats. Just barbaric. This is how you put in a perfect pedicle screw. You put it in, you create the perfect starting point in the perfect trajectory, and look at that with navigation. I really do feel like I'm cheating. I feel guilty. This is not right. Not fair. So that's how they stay together, maybe. We're talking about the first glue made from horse hooves. I still don't understand how that could be. This is the Mr. Miyagi technique right there. It only works on osteoporotic patients though. Woo! Look at the bone is so beautiful, so trabeculated. It has such a good feel too. Great. Doing some discectomy. Got my pinky out, using my delicate Asian fingers, because you want to preserve the integrity of the end plate bone so that it can support the expandable cage, also known as the sexiest cage alive. Can't wait for you to see that. Alrighty, I've done a careful inner body preparation, taking the disc out, scraping off the cartilage off the edge surfaces of the bone called the end plate. Now I'm using the most expensive bone graft. It's injectable. You can see why that's important for minimally invasive surgery. And it's not coming from your hip. And it's pretty looking too. One more. Okay, putting in the sexiest cage alive. It is gold. I love that color. It is 3D printed, so the edges are custom designed, so it's soft. It's got a bulleted end. It's got a huge bone graft window. But here's what makes it sexiest. It goes in small, and look how big it gets. It's almost obscene. You're probably like, okay, that's it. But no! It's probably like, no, there's no way it can get bigger. But no! 10 to 17. It's crazy. And this is going to make him feel taller, stronger, faster, sexier. Oh, sorry. Thinking about something different. But you know what I mean. This is going to be phenomenal. Mallet, I got it. Anything, Ali?
No quiet so far.
This is the scary part because I'm going right by the nerve. That's why Dr. Asimov is monitoring the nerves. I've got my left corner of my eye on your butt cheek and my other eye down the surgical corridor. That feels so good. I don't even know what to do with myself. Okay, bed up. Oh, this feels so good. Shut and save. It's getting bigger. Ooh, it's already tensioning. Just the way we like it. Shut and save. Woo, la 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 la.